slow, change not. Since electricity is problematic, let's keep things as they are. Let the candles burn. Doesn't matter. So cars kill people. So don't use them. You better go on foot. It reminds me of late 18th century, 19th century London. When cars were introduced, they had somebody playing the bugle who had to walk in front of it, and the car used to follow them because it could potentially kill people. Look where we are now. So no progress. Let's keep things as they are, and that is the best way forward. They are not going to be that useful, and since robots are so dangerous, as one of my adversaries very eloquently put, that they can kill people, etc., etc. But may I remind him, and he's a surgeon, may I remind him that robots do cause less trauma. It has been now proven. There are equipments already available where they are doing venipuncture and other tissue collections. In fact, they are doing surgeries, and they are able to do a much better job than a human being can do. And lastly, let us come to AI, artificial intelligence. Look, artificial intelligence is a whole different topic. So somehow shifting focus to it would require a paradigm shift in this whole discussion. But let me just touch upon it. It definitely helps us to deliver better care. And that is what we are trying to do. If somebody is thinking that an AI will come and some magically the doctors would all melt away, although I do believe some doctors might like it because the COVID situation is causing a lot of deaths. So, and they are the ones who are having the highest rates world over. So I am not too sure whether AI doesn't have a place. But what about how do you do the AI without data? And where do you get the data from? Paper? Is somebody serious in this day and age that we can do with data from paper and expect the AI to deliver magic? No, no. And we do know that AI can really help. So therefore, I would finish off my opening salvo with these few points and see what the others have to say about all this. Thank you.
Thank you, Dr. Bhattacharya. So now that we've got, I think so we've kind of arrived at equal score now. Thank Dr. Piyush for that, keeping the score for us. Back to you, Dr. Tanga. So what do you have to say from the perspective of papers, and a quick note to everybody. Believe you me, all the four panelists are actually digital health evangelists, but we are having this discussion purely to move or make a nudge the nation, as I was trying to say in some of the notes that I was sharing with the group. So over to you, Dr. Tanga.
Thank you, Manish. Yes, I think the whole idea of having this encounter this kind of a situation when we are at the customer side, because on the customer side, we do have strong proponents of status quo, as Dr. SBB mentioned, continue to burn the candle types. And there are the strong supporters of, let's go to Mars and let's go to Andromeda galaxy types. So a good implementation the two aims and walk the middle path that Buddha taught us. So coming back to the point that we were making, paper is not going anywhere, right? Instead of making it a this or that, a binary 0 or 1, we need to accept the fact that these two are going to coexist, and digital as of wards into the hospital, into the OPDs, into the lab, into all clinical settings because the paper forms converted are continued in the department. This is clearly wrong. Digital is a new way of working. Capture once, use multiple times. Demographics used to be captured on paper, 10 to 11 investigations in the emergency, and you have to write out these 10 to 11 investigations by hand, name, age, sex, MRN number, unit number, so you waste a lot of time in doing that. If you take it digitally, this process can be sorted out, because you can record it once, and you can even allow the patient to fill this form outside on an app, and you can just input it directly into the electronic medical record. So or the digital way of doing is better than paper, because I don't believe that is possible. What I'm saying is, you may use the newfound techniques, and you may use digital technology, but in the end, when the patient goes out, you have to print a discharge summary and give it to him in his hand. I'll stop there.
Dr. Sandeep?
Yeah, sure. So it may not be that we do not have replacement of paper with artificial intelligence, but we may have replacement of paper with digital paper. And the example you cited, Dr. Prabhu, about patient requiring an handover or a discharge summary, it could be done in the form of a text message or other applications. So the other misconception that I want to clear here is artificial general intelligence is a science fiction. We are not going to have any replacement of any function by human doctors. Maybe aspects of what radiologists do, dermatologists do, ophthalmologists do could be, but a complete replacement of doctors is not going to happen anytime soon. So I don't want to dwell into the mathematical reasons and the computational reasons for that, but that's many years away. So what we are talking about is the current narrow artificial intelligence or the narrow digital. Sort of sets the scene and also gives my perspective as how I envision things will work. So nowadays we are talking about human in the loop in terms of artificial intelligence systems or smart systems. And if we focus on that, then we would not really have to get into this kind of debates, but talk about how artificial intelligence can be augmented intelligence. It's not so much an issue in the Indian context, but in the United States, people are talking about electronic medical record, a physician burnout. That's mainly because electronic medical records were not constructed to keep in mind the clinical aspects, but more for reimbursement purposes. So that's why you would definitely have a biased perspective coming from the US context. But in terms of India itself, we're talking about a huge healthcare system where people are not, the data is not being collated in an appropriate fashion. People are not able to follow up. There's no longitudinal care. It's episodic care. I really, really doubt if paper can be an ongoing solution to address that.
Thank you, Dr. Sandeep. Over to you, Dr. Gogia.
Thank you. I'm hearing now that EMR is flying back and winning over us. Very interesting. Yeah, first of all, I never took it as this thing that is, we are going to get rid of EMR, as Thanga said. We're not going to get rid of paper, neither of EMR. Our main focus right now is at the current day and age, is paper better than EMR? Obviously, it is a matter of both, first of all. First of all, before I come to those points, I'd just like to answer two of this thing which were pointed points which are pointed out by SPB. One was that we should not go in cars because cars can kill. That is not the issue. The issue that we are trying to say is, do automated systems in cars kill more or less? He says they kill less. Fair enough. But when they kill, who is responsible? And can it be deliberately driven towards a particular site? We have to solve these issues. When we are looking at AI coming in and all that, there are, AI and computer systems depend on many more sensors. They've got GPS, they've got, gyroscopes. Huge number of things are possible when IT systems to do things better, which the humans don't have. But the thing that humans have, till AI data, when we say data, it has to be calculated correctly.
Please get your cup of chai ready.
What the data that comes on paper and that is, signed in these things, it is a permanent record. Data in the virtual space can disappear in a wisp, can be stolen, manipulated later after. We say that we are trying to build in the methods to stop it from being this thing. That's because the possibility of